Understanding sadness and grief, emotional and physical impacts. Exploring the connection between emotional state and their physiological effects, focusing on how sadness and grief influence the heart, lungs, and overall well-being. Understanding sadness and grief. Sadness encompasses feeling of regrets and longing, often linked to past action or decision, and profoundly affects both mental and physical health, particularly the heart and the lungs, leading to emotional imbalances and health issues. Recognizing and addressing this emotion is essential for fostering emotional well-being and promoting healing. Understanding the nature of sadness. Regrets and longing. Sadness includes feeling of regrets, often causing individual to dwell on past action or decision. This emotional state can create a cycle of negative thinking, leading to further distress. Complex emotional pain. The complexity of sadness can manifest in various ways, including emotional pain, a sense of loss, and an inability to find joy in daily activities. These feelings can significantly impact mental health. Focus on negativity. Sadness often leads individuals to focus on negative experiences, which can create emotional barriers and hinder personal growth. Over time, this may contribute to feeling of isolation and despair. The clinical impact of sadness and grief. Sadness and grief significantly affect the heart and lungs, leading to a range of physical symptoms. According to traditional texts, this emotion cause the heart to become crumpled and agitated, which obstruct the lungs, preventing the pre-circulation of qi. Symptoms including a weak pulse characterized by the lack of wave, a weak voice, tiredness, pale complexion, slight breathlessness, and emotional distress. Effects on the heart. Sadness causes agitation and cramping in the heart, which can lead to various emotional and physical symptoms. This emotional turmoil can create an obstruction in the lungs, impeding the circulation of the qi and causing heat accumulation. As a result, individual may experience a multiple health issues related to the compromised function of these vital organs. Consequences for the lungs. The obstruction of the lungs due to heart agitation adversely affects qi circulation, leading to symptoms like a weak voice, tiredness, and breathlessness. This interaction reveals the interconnectedness of emotion and physical health, as a prolonged sadness can deplete lung qi, resulting in the deficiencies that further exacerbate physical ailments. By the essence qi and its relation to emotion. Vital role of qi. Qi is essential for maintaining health and vitality. It flows through the body, influencing physical and emotional well-being. When qi is abundant and balanced, individuals experience optimal health. Impact of sadness on qi. Sadness and grief can significantly reduce the level of qi. This depletion can lead to various health issues, including chronic fatigue, emotional instability, and weakened immunity. Stagnation of chi. A chi becomes stagnant due to prolonged sadness and grief. It can result a range of health problems, reflecting the interconnectedness of emotion and physical health. Pulse diagnosis and sadness and grief. Pulse indicate emotional state. Weak pulse indicates sadness. No wave flow signal. Front position are crucial. Pulse reflect chi deficiency. Physical manifestation of sadness. Sadness can lead to various physical symptoms that reflects an underlying emotional struggle. Common manifestations include a weak voice, chronic tiredness, pale complexion, slight breathlessness, weeping and sense of oppression in the chest. And women, sadness may also cause deficiencies such as amenorrhea due to depleted lung qi. Long-term effect of sadness and grief. Stagnation of qi. Prolonged sadness and grief can lead to stagnation of qi, obstructing its flow and resulting in chronic health issues such as fatigue, respiratory problem, and emotional imbalances. Emotional disturbances. Persistent emotional disturbances from sadness and grief may manifest in various ways, including anxiety, depression, and difficulties in maintaining relationship, impacting social well-being. Physical complications. The depletion of lungs and heart qi due to prolonged sadness may lead to additional complications, including menstrual irregularities in women and overall decline in physical vitality. Heart and lung primarily affected organs. Sadness primarily affects the heart and lungs, leading to symptoms such as agitation and a lack of qi circulation. The heart becomes crumpled and the lungs are obstructed, resulting in physical manifestation like a weak pulse and breathlessness. Liver, secondary impact of sadness. In addition to the heart and lungs, sadness can impact the liver, causing mental confusion and emotional instability. When sadness depletes the liver, it can lead to issues like yin deficiency and difficulties in emotional regulation, affecting overall mental clarity and direction in life. Understanding sadness and grief for emotional health. Recognizing and processing sadness and grief is vital for maintaining emotional balance. This emotion can deplete qi and affect various organs, making it important to reflect on them for better mental and physical health. Embracing these feelings can lead to improved coping mechanism and enhance overall well-being. Understanding sadness and grief emotional and physical impacts.